Do you ever feel like worry is a constant companion? Everyday tasks feel overwhelming and your mind is a whirlwind of anxieties. If so, you might be experiencing Generalized Anxiety Disorder, GAD. Unlike the occasional nervous flutter before a big presentation, GAD is a chronic condition characterized by excessive and uncontrollable worry that disrupts daily life. This pervasive anxiety can take a toll on your relationships, work, and overall well-being. However, there is hope. By understanding GAD and the tools available to manage it, you can break free from the cycle of constant worry and reclaim your peace of mind. What is generalized anxiety? Generalized Anxiety Disorder, GAD, is more than just feeling stressed or worried from time to time. It's a mental health condition characterized by chronic and excessive worry and anxiety about a multitude of things, even everyday situations. While occasional anxiety is a normal part of life, GAD takes worry to a whole new level. People with GAD experience intense and persistent worry. This worry can be about anything: finances, health, relationships, work, or even seemingly trivial matters. The anxiousness often feels out of proportion to the actual situation. Difficulty controlling worry. Despite knowing their worries may be excessive, individuals with GAD struggle to stop them. It can feel like a never-ending cycle of rumination and negativity. Physical symptoms. The constant worry can manifest in physical ways like muscle tension, fatigue, sleep problems, headaches, and stomach aches. Difficulties in daily life. GAD can significantly impact daily functioning, making it hard to concentrate, complete tasks, or maintain healthy relationships. Unlike phobias, which are triggered by specific situations or objects, GAD involves generalized worry that permeates various aspects of life. In the next section, we'll delve deeper into the causes of this persistent anxiety. Living with generalized anxiety. Imagine a constant low hum of worry as your daily soundtrack. That's what life with Generalized Anxiety Disorder, GAD, can feel like. For people with GAD, everyday situations can transform into mountains of concern. Going to work might trigger anxieties about job performance, social interactions become fraught with the fear of judgment, and even basic tasks like paying bills can morph into a whirlwind of what-ifs. This constant state of worry takes a toll. Relationships can suffer as irritability and fatigue become prominent. Work performance might decline due to difficulty concentrating and completing tasks. The quality of sleep often deteriorates, leading to further exhaustion and a worsening of symptoms. It can feel like a vicious cycle, with worry feeding into physical symptoms and vice versa. However, it's important to remember that you're not alone. Millions of people worldwide grapple with GAD. The good news is, there are effective strategies to manage this condition and improve your quality of life. In the following sections, we'll explore self-care practices and treatment options that can help you break free from the grip of constant worry. Treatment options for generalized anxiety. Living with generalized anxiety doesn't have to be a life sentence. There are effective treatment options available that can help you manage your worries and reclaim control of your life. Here, we'll explore two main approaches: therapy and medication. A therapy, cognitive behavioral therapy, CBT. This is considered the gold standard treatment for GAD. CBT helps you identify and challenge negative thought patterns that contribute to anxiety. By learning to recognize and reframe these distorted thinking styles, you can develop coping mechanisms to manage worry more effectively. Other forms of therapy, depending on your individual needs, other therapy approaches like mindfulness-based techniques or relaxation training can also be beneficial in managing anxiety symptoms. B. Medication. In some cases, medication may be recommended alongside therapy to provide additional relief from anxiety symptoms. Antidepressants. Specific types of antidepressants like selective serotonin reuptake inhibitors, SSRIs, can help regulate brain chemicals that play a role in mood and anxiety. It's important to note that medication should be prescribed and monitored by a doctor or mental health professional. They will work with you to determine the most appropriate treatment plan based on your individual circumstances. Remember, seeking professional help is the first step towards managing your GAD. In the next section, we'll explore resources for finding a qualified therapist or doctor and provide additional support options. Conclusion: Generalized Anxiety Disorder, JD, may cast a shadow of worry over your life, but it doesn't have to define you. With the right tools and support, you can effectively manage your anxiety and reclaim your peace of mind. Remember, you're not alone in this journey. Millions of people around the world cope with GAD, and effective treatments are readily available. Don't hesitate to seek professional help. A qualified therapist or doctor can equip you with the skills and strategies to manage your worries. There are also numerous resources available online and in your community to provide support and information. Take heart. With knowledge, self-care practices, and potentially medication, you can break free from the cycle of constant worry and live a fulfilling life. Let me know in the comments your favorite way to manage anxiety and share this video with anyone who might find it helpful. Sending you all good vibes.